It's just always there, but I'm lucky. Because I had you lot. I had the best.
Oh, bless you.
From the most terrible of times, the most precious of friendships. Once patient and nurse, Janine Welford and Colleen King's bond has lasted 30 years. 30 years since Janine suffered horrific injuries in a fire at a Hull paint factory, and Colleen cared for her in the Regional Burns Centre at Pinderfields Hospital in Wakefield.
I couldn't see anybody, I don't remember like faces, but I remember voices, and I remember Colleen asking me questions, you know, and like I said, I asked you about my hair because I was supposed to be going out that night. I thought I was silly, thought I could still make it. And I asked you what my hair was like, and you said, what was it like before, short and spiky? So she said, oh, you're all right then, but I won't going anywhere.
No.
Janine, then Janine Gill-Fillan, was an 18-year-old working at the Humbrol plant on Hull's Heddon Road in 1988 when an accident saw it go up in flames. Her friend and fellow worker, 17-year-old Jennifer Powley, was killed. With 80% burns to her body, few thought Janine could survive.
That's me, that's my friend Helen. She was the one, when I was laid on the grass, she was a first aider. And I remember saying to her, am I still pretty? And she said, yeah, you are. And then it was only a few years later, I was at our house in Wales, and she said, I didn't even know it was you. Do you know? She said, I didn't know it was you that I was talking to.
We could see what she was capable of, and you know, she had a massive injury, and she worked hard at getting better and getting home. Very special, inspirational lady.
I don't think so.
I think so.
I don't.
So I'll just show you how big these rooms are in comparison to yours that you were in.
Now Janine has returned for the first time in decades to the hospital which saved her life. This unit is very different from the one she spent 4 months in following the fire. That original building was the first specialist burns unit in the country to be built with public money when it was opened in 1966 by Chief Medical Officer Sir George Godber, who'd been instrumental in setting up the NHS itself. 2 decades later, the centre led the way in treating victims of the Bradford City fire in 1985, still one of the largest mass casualty events it has dealt with. Now, between 150 and 200 inpatients from across the region, some with serious or life-threatening injuries, are seen by staff each year in the unit which replaced it. Equipment, technology and design have changed, as have the nature of the burns the team here treat.
People's houses are safer, people's workplaces are safer, and we really don't that often see major workplace injuries anymore. We're seeing, I think, increasing numbers of elderly and infirm people who get burnt in the home. Simple things like radiator burns, people collapse and lie against a hot radiator and get quite deep injuries from that sort of thing. But I think the picture has changed.
But for retired consultant and former director of the Burns Centre, John Settle, who was there from the very beginning, the one thing that has remained constant is the ethos of those who work there.
Generally, if somebody came to work in the burns unit, if they lasted for more than the first month or two, they stayed forever. Now, it's that sort of commitment that you need. It's not about bricks and mortar. Although I know I've seen the new unit and it's all very nice, but ours was a purpose-built unit as well. We thought it worked very well. But it's the people. If you've got the people, it'll be okay.
Just bob your blood pressure cuff on your arm, my darling.
And Colleen King is one of those people. A nurse for 44 years, she's worked with burns patients for 40 of those, making her the longest-serving burns nurse in the country. Such is her commitment. After retiring last year, she's back on the wards 2 days a week, doing the job she couldn't quite give up.
Nursing is inherent, and just being able to care and be able to recognise when somebody needs that care. But we work as a team, and that comes from the top to the bottom. It doesn't matter whether you're an HCA, whether you're a sister, whether you're a consultant, we work together, we are a team, and it's that team that gets that person through their injury.
And who sometimes, along the way, becomes a lifelong friend.
It's been amazing.
Absolutely.
Love you too, darling.
Lisa Adlam, ITV News, Pinderfields Hospital in Wakefield.